My name is Claire Barnes. I am a Trainee Nursing Associate at the Christie NHS Foundation Trust. My first encounter with where I work now was when my mum was an inpatient at the Christie with terminal cancer, and I decided, because of the care that she'd received when she was at the Christie, that I wanted to take a role where I could give something back to them. Originally I was an admin bod working from home, so when I applied to the Christie I applied at the endocrine department as a clerical officer. I then switched in July last year to work as a healthcare assistant, and then this role came up and here I am. The thing that inspired me to apply for the Trainee Nursing Associate role was one of our staff nurses, Sharon, who'd seen the advertisement for the position. Obviously there'd been a lot of things when I first came to the healthcare role that was being stopped progression wise, and this was a really exciting opportunity to have somebody say to you, I think you'd be really good at that. It encourages you to think that you can go on and do something better, so I applied. The biggest challenges in this role, I'm a single mum. I've got a nearly 13-year-old, and trying to get that balance between the work life, the home life, studying. It is the full package. It is difficult. You have to be really strict on your time planning, and I think that is the biggest challenge, to get everything in and get it done really. I am so excited about going on the community placement. I'm like giddy. I want it to be now. That's my next placement. I'm started off in endocrine. I'm doing the community, then I rotate to surgical, and then I'll be on one of the wards, but the community experience for me is the most exciting. I think it's something that we wouldn't necessarily get the opportunity to do generally, and to be able to go out with the guys to care for patients in their own home in that setting, I think it's a privilege to be given that experience, and obviously the trust that the patients have to let us go in and look after them. I'm excited about that, I really, really am.
My name's Lauren Hughes, I'm a Trainee Nursing Associate and I'm working at the University Hospital of South Manchester. I've only been working in the NHS since last May, something brand new to me. Before I worked at the hospital, I worked on Gorta Market on a butcher stall, so this is completely different. I saw my uncle and granddad going into hospital quite a lot and the care they received, and I thought that's something that I was really interested in doing, so with no experience I applied for the job. Some of the inspirational people I've met are the carers that looked after my family. The care they give was second to none. They was really, really supportive of my family and us ourselves, and they did everything they could to make sure that we was all happy. In my current role now, my ward manager is absolutely fantastic. She's only 28 and she's built herself up from a nurse to sister to ward manager in such a short space of time, so I'd love to be anything like her. It'd be amazing. The support that we're receiving is actually really quite good. We have an assessor on our ward that's there to help and be a mentor basically if we have any questions, and they'll help us. With regards to university, we've also got personal tutors, and any of the tutors there have said that we're welcome to ask them any questions that we receive. And MMU have actually got like a study support group for us just for the Trainee Nurse Associate role, so if we've got any queries then we can just go to them and they'll help us with anything that we really need. I'm really excited to be going out on new placements in different units that I've never been before. Obviously I'm used to working on a dementia ward, and at the minute my first placement is a respiratory ward, so it's obviously something completely different. Working on a dementia you need a lot of communication skills, whereas working on a respiratory ward it's a lot more medical than I've ever been used to. So I'm excited just to learn something completely different. We've also got surgical placements and community placements, which again is something I've never even thought about going on, and I've got a spoke coming up on the paediatrics and maternity ward. So it's giving us the opportunity to cover every base of a hospital and see where we find ourselves being good and where we want to be. In 3 years' time I want to be a qualified nursing associate. I would love the opportunity to develop myself and go on to be a fully qualified nurse, but as long as I'm working in a hospital, looking after people and developing myself as a person, I'll be happy.
My name's Kim Donnelly. I'm a Trainee Nurse Associate at Royal Oldham Hospital within Pennine Acute Trust. So far it's been quite a short journey. I've only been in the NHS about 14 months. Started out as a HCA on acute medical unit at Oldham. From there, applied for the Trainee Nurse Associate role. I've always wanted to work with people. I love working with people. I actually worked in customer service for about 10 years before coming to the NHS. I love people, I'm passionate about helping them, and I wanted to take that a step further. When I was successful, I felt amazing, ecstatic. First person I phoned was my mum to tell her all about it. It's just a big accomplishment for me, a big, huge accomplishment. We have a really good support network going from the ward all the way through to university. We have our mentors on the ward, we have our assessors, we have our tutors at university, and they're all fantastic. The doors are always open, we can always go to them and speak to them about anything, whether it be about work or whether it be something personal. I think I'm really looking forward to working in the community. It's very different to what I'm doing now. On the acute medical unit, it's very busy, and I know it'll take it down a notch and it'll be a bit slower, but I think I'll get a lot of satisfaction out of going into the community and working with people in that way. My inspiration for applying for the TNA role was my mum's actually a nurse. My mum inspired me. I have friends who are nurses as well. My mum was a single mum. She brought me up on her own. She went out and she did a training and she became a nurse, and I'm very proud of her for doing that. Such restricting time for her, you know, to be able to go and do that. She put all her time and effort into it, and she brought me up, and I just hope she's proud of me.
My name is Gordon Smith. I work at Central Manchester Foundation Trust, and I'm currently based in the community as a Trainee Nursing Associate. In 2006, I started working with NHS Lothian up in Edinburgh, and later I started working with Lancashire Care NHS Foundation Trust, also as a healthcare support worker in the field of mental health. Later, having moved to Manchester for bigger and better things, I started working with NHS professionals, and I was based at Manchester Royal Infirmary at the Central Manchester Foundation Trust, and I was working with them for a period of about 6.5 years before deciding to join the Trainee Nursing Associate programme. The people that I found the most inspirational, especially since coming to Manchester, have been two matrons that I've worked with in the past. I worked with Anne Palmer on the surgical ward at Manchester Royal Infirmary, and later a gentleman called Jay Murdoch, and both of whom I've always admired their sheer professionalism and their commitment to the job, also their dedication to providing quality patient care. I think another thing for me with regards to professionalism, they were both highly approachable, and approachability is something that I value in a leader. I'm excited about gaining all the new experiences in the variety of settings that has been planned for the Nursing Associate programme. I'm based in the community at present, which has been a totally different environment to work in, and you get a greater appreciation for the relevance of what we do for an individual in their own home environment. In 3 years' time, I would like to be working confidently as a nursing associate on perhaps a busy ward, and really making a difference to the provision of quality patient care. And also, additionally, I would like to take my career further and take on new roles, responsibilities and challenges.
My name is Tariela Langdon. I'm a Trainee Nursing Associate. At the moment, I'm working in Thameside General on HUGHES ward, which is a mental health ward. My NHS journey so far has been brilliant. I've been with Penine Care for 3 years now. I was in the community previously, so working in mental health in the private sector. Prior to that, I was a tutor in the community. I used to teach IT, basic IT skills, to the unemployed in local community in Moorside area. Some inspirational people that I met along the way, I'm still friends with them to date, was my very first shift as a home care assistant. We went to a property and what I saw behind the door was different from what I was expecting. That was my very first call. And I said to myself, I'm not going to go back. I can't do this job, it's hard. And it dropped me off lunchtime. He came back to pick me up. I was in tears. He was like, why are you in tears? I said, after what I saw this morning with that gentleman, I find it really hard. I don't know people suffer that much. And he said, that's why we're in this job. Come with me, we'll crack it. So I went with him and I've not looked back since. When I was accepted for the role as Trainee Nursing Associate, I was in IKEA. The security men were shocked. They were like, what's going on? I'm like, I got a job. What job? I'm like, just, you know, I was overjoyed. I was glad I got it. Where I hope to see myself in 3 years' time is after qualifying as a nursing associate. I would like to remain within mental health so that I can gain more experience and have a general overview of what my role would be upon qualifying, and see how far it takes me from there.
I'm ANNALIESE HIGSON. I'm a Trainee Nurse Associate at Royal Bolton Hospital and I'm currently on Clinical Decisions Units. I've met some really inspirational people along my way. First of all, my family who got me into this kind of profession. My mum was saying, you be good at this, ANNALIESE, you really caring, you can look after people well. So thanks to her. And then my managers in A&E, I think one of the senior sisters there really took me under her wing and she championed me to go further. And when the role came up, she really pushed me to do it. She said, you know, you can do this, you've got the skills to do it. Watching her look after people in such a senior position, I always thought they were more away from patients, more in the background. But she is the nurse the kind that I want to be. She was with the patient. She went around with the brew trolley when she had 5 minutes, and I just found it so amazing that she had time to just look after all of her staff and all the patients so well. When I was successful, I was actually got a phone call when I was in work. There was about 100 staff stood around me, so I was apprehensive to say the least, but when they said I'd got it, I was ecstatic. I was just so excited to join a new role in the NHS, something that nobody else knew about. We were going to hopefully shape this role how we wanted it to be, and when I got home, that's when the nerves set in. I thought, oh my word, what have I done? I need to leave my job, I need to start a new placement, and I was quite nervous but excited, and I'd made so many people proud, my family and my colleagues and my managers. Everyone was just so proud of me and it was a really nice feeling. In 3 years' time, hopefully I'm still smiling, enjoying my job, wherever that may be, the community or the hospital. Hopefully there's a way to progress from being a trainee nurse associate into a nurse, and if that is a route that's available to me, that's probably the road that I'll go down. But if not, I'll be on the wards or in the community, just at a higher level than what I was, just delivering care and enjoying my job. I think it'll be hard. I think studying at a degree level is something I've not done before. I've done a foundation degree, but this is obviously a step up from that. We're given 1 day a week for university and 3 days in placement. So it's just trying to balance that time to have to say no to a night out once or twice a month.